Hi, I am Maria from CARECulate, where we simplify, redesign, and innovate. Did you know that there are about 1,800 hospitals across the Philippine archipelago? Shocking, right? But there are only 23 hospital beds for every 10,000 Filipinos living in NCR. Moreover, during the pandemic, both public and private hospitals are at full capacity level. Due to the increasing demand for healthcare, hospitals are being pressured to be able to maintain quality healthcare while balancing limited resources such as the number of inpatient beds together with the number of doctors and the number of nurses available. According to an interview conducted on a personnel from the Department of Health, there is a shortage of healthcare facilities, medical resources, and healthcare workers. Medical frontliners struggle to render a quality healthcare due to the scanty supplies and short staffing in the facility. Thus, it is essential to find a solution regarding this matter for both public and private hospitals for them to have proper capacity planning so that they can balance the quality of healthcare delivered in accordance with the limited resources. You may ask about how we could address this. To optimize the capacity planning for hospitals, we propose to use a linear integer programming model to solve the challenges faced by decision makers. What is a linear integer programming model? It is an optimization program where variables are restricted to be integers so that the output values would only be integers. For example, the sets of medical doctor types and nurses types are not rational numbers. I mean, is there even a one-fourth medical doctor or one-half nurse? So that's the reason why they should be restricted to integers. How does this solution work? The basis for this solution is adapted from the study by Irfan Fahmy et al. Entitled An Optimization Model for Solving Integrated Hospital Capacity Planning Problem. In our solution, the datasets will be tweaked to fit the Philippine healthcare setting. Here we can see the sample linear integer model, which minimizes the total cost of expenditures of the hospitals, ranging from the cost for doctors to the cost for technicians, which are provided in the sets below, as well as the decision variables. To solve for the linear programming model, we will utilize the branch and bound approach, which is an algorithm to obtain the optimal solution, which would then result in the sample table provided. These are the results from our anchored paper of Irfan Fani et al. The table shows the number of nurses needed from the gathered data of their selected hospital. Why CARECulate? After the solution is presented, where does CARECulate come in? Now, CARECulate comes from the words care and calculate, which literally means to help healthcare facilities, particularly hospitals, calculate the maximum utilization of their limited resources. As shown in the star in its logo, CARECulate aspires to be a guide in capacity planning in healthcare hospitals. How can we make this project possible when we cannot obviously do this with our own hands? In order to make this project a success, CARECulate will collaborate with two government agencies, namely the Department of Health and the Department of Science and Technology, as they will be helping us in obtaining the data and acquiring the funding, respectively. With CARECulate, how do we see the future? This is our goal: to have at least one hospital to use the model in determining their capacity while improving their capacity planning based on the data they have on hand. Thank you, stay safe, and stay healthy. CARECulate now.